Dr. Franco, thank you so much for your time. I know you're very busy, and we're very much looking forward to a conversation on veterans health. Natalie, also a pleasure to have you with us. Maybe you can introduce your dear friend, Dr. Franco.
Sure. Dr. Franco and I have worked, he leads projects on veterans and specifically interested in veterans and PTSD, other stuff too. But we've worked together in this space for the past couple of years. And I thought he'd be great to have on the podcast because veterans issues are relevant to national security, and we'll be discussing that today. But first, Zeno, or Dr. Franco, can you introduce yourself and your work for our audience?
Sure. Thanks, Dr. Baker, for having me, and Abdullah and Elena. I really appreciate the time, and it's a pleasure to be here. So my name is Zeno Franco. I'm an associate professor in emergency medicine at the Medical College of Wisconsin, and I serve there as the director of research, education, and training, working with new physicians coming up in the space to do research on these topics. I've worked in veteran engagement for about the last 15 years for the medical college, and have recently returned to clinical work at the VA in Milwaukee as well. So working directly with U.S. military veterans in many different contexts, literally in the street and also in the clinic. I should say, for the good of the order, that I'm really speaking on behalf of the medical college today, even though I have a split role. But I'll talk a little bit too about some of my interactions with veterans in a clinical setting, but I just want to be clear that I'm not speaking on behalf of the VA today.
Can you also please explain your experience with veteran healthcare, and in addition to that, in what ways your initiative has been helpful to the veteran healthcare system?
Yeah, so I think that's a great question, Elena. So, for me, I was trained at the National Center for PTSD in the VA system. Came to Milwaukee and finished out my training here, got a PhD in clinical psychology, and really kind of had seen the world from the VA lens for a long time, and really thought about trying to provide high quality evidence-based care for veterans for combat trauma through that model. What happened for me, for whatever reasons, life takes its course, right? And so at the end of my training, I didn't get a job at the VA. And so I needed to find a different kind of line of work. So I went to a postdoc at the Medical College of Wisconsin. And for whatever reason, that postdoc had an emphasis on primary care, but also community engagement. And so I asked, could I do community engagement with veteran nonprofits in the region? I'm trying to keep with that sort of component for me that was super important, right? As not just a career, but a mission of working with U.S. military. And so, that was an option that I asked for and was given to me. And so I had the pleasure of then doing what has been really a novel task or a novel job, which is thinking through what does veteran community engagement look like. This has been an area of increasing interest for the VA system, but also more broadly as well. So I've published what was the first special issue on veteran community engagement in any academic publication that's been offered so far. So I was very proud and gratified to be able to do that. But while that's a career boost for me, it's really a way of documenting the stories of many, many veterans who have struggled to get care. And I think through this process, I've really listened to a lot of folks who have a lot of different feelings about both VA care and civilian care for U.S. military service members who are trying to reintegrate into civilian life after service.
Dr. Franco, so given that there may be people in your system that are both patients of yours that have day jobs as part of their everyday work, but they're in the military, serving in maybe the reserve or National Guard. What's the impact of what you're seeing on military readiness in terms of the healthcare system? Is there an impact? From what you can discuss, maybe you can highlight some of that.
Yeah, absolutely. So, again, kind of harkening back to this 15-year journey in veteran community engagement, I've heard story after story about people who were either still active duty or who were in the reserves or the National Guard, who were thinking about redeploying for whatever reason. And I think just a lot of worry about what's in their mental health chart in the VA system, how much access DoD healthcare has to that, how much they're willing to disclose, what diagnostic pieces the clinician is putting in. And so as a clinician, I'm just speaking here as a personal clinician, there's kind of a tension between diagnostic accuracy, right, and ensuring that the service member, who from my perspective is a veteran, but from their perspective may be getting ready to re-enlist or whatever the considerations are, I want to try to protect their privacy. And so that tension just there between diagnostic accuracy and the soldier's privacy, right, or the Marine's privacy, because I know the Marines get sticky if you say soldier. I'm kind of teasing y'all. So we kind of do that service member a disservice in some way by not having a way for us to really say what's going on, right? And also to make a good judgment about, are they ready to redeploy? So, I'm sitting here trying to protect the fact that maybe this veteran is really acting out in some situations, for example, or is really struggling with their family at that moment. And maybe it's beyond just an adjustment issue. It's something that's a more serious diagnosis. At the same time, as a clinician, I may not feel like it prevents them from re-enlisting or from being called back up, right? But I know that here's the catch-22. I know that if I am too diagnostically accurate, their unit may say, we don't want you to come back, right? You're not ready. Mm-hmm. But I also can't get them the help that they need unless I do provide some more detailed information to the healthcare system. So that's the bind that clinicians in this space often find themselves in.
And if I can ask, can you share any particular stories that you found to be most impactful, or just something that you remember that are very helpful, or that you can remember today that just stands out to you that you think would be very helpful to our audience?
Yeah, I mean, I think on the community engagement side, there have been countless times where I've talked to veterans. So I work a lot with veteran nonprofits. So I work with a particular one here called Dry Hooch of America that does a lot of sort of street-based work with veterans, and frankly, a lot of them are combat veterans who are very, they're experienced, and they're also experiencing very serious problems in their lives. I mean, this is where I'm able to speak a little bit more freely because it's not privileged information. Arrests that are very difficult to arrest, police involvement, ATF involvement. I mean, it gets quite serious, right? Homelessness, drug and alcohol abuse, everything that you can imagine. Folks that are on the fence about kind of where they stand with, am I going to retire? Am I going to discharge? Or am I going to go back? Am I going to redeploy? They will tell you time and time again, they have not sought the care that they should have. They have not been completely open with their provider. They're being cagey. And so there's this profound tension with the soldier or Marine, thinking about, what can I do to help myself and how much do I need to hold back, right? And it comes up over and over and over again.
Well, so if I can kind of follow up to that, what kind of advice would you give, people in leadership positions, who may have subordinates they want to get the care they need, or they're concerned about their lives, and that there's some indicators there that things may not be all together? What kind of advice would you give? We have a lot of senior leaders that pass through our doors, on the way to more strategic level assignments. And so, they're at this executive levels of leadership where there may not be in a direct space and at times. So that kind of complexity is there. What kind of advice would you offer them?
I think one of the most concrete pieces of advice, and this might not be for the leaders themselves, but for the folks that they're guiding in the space, right, is to pick up the phone. So oftentimes I'll be asked by a service member, can you fill out such and such paperwork and send it to my unit, so that they know kind of what my diagnostic profile is, what kind of care I've been getting, and make an assessment about whether or not I'm ready to deploy. And again, that caginess is going to come up in this space, right? I'm not really willing to say too directly what I think on a piece of paper. And so I think if the person at the unit level who's making an assessment about this soldier's readiness were to pick up the phone and talk with me, I mean, this is, with the soldier's permission, right? There needs to be a release of information in there. But I think sometimes not having that all on paper would be helpful, right? Because I think a more nuanced conversation can happen about where the soldier may be struggling. And does that really impact readiness or not? Sometimes the diagnostic picture looks very complicated, but it has everything to do with their civilian life and probably very little to do with their military life, right? And so, I think that's a distinction that is easier to offer in a conversation than it is on a piece of paper.
And I think, part of the problem is also that there's this idea that because someone is struggling, whether it be mental health issues or dealing with trauma, whether it be from combat, and also realizing that doesn't necessarily come from combat alone, right? A lot of people who enter the military come from backgrounds where there is trauma, and that's one of the appealing aspects of serving in the military. But just because someone has those struggles doesn't mean they can't perform their job. In fact, because military identity and culture is such a salient part of who people are, if you are to say, if they're separated from the military because of mental health struggles, that can lead to a pretty profound downward spiral.
Yeah, and we know that work is therapeutic, right? And there are countless situations where I'm working with a veteran who, I mean, it sounds kind of counterintuitive, even though they're experiencing serious problems, right? The best thing for them at that moment in their life is to redeploy, right? Like, that's going to be what makes a difference, in terms of stabilizing to Dr. Baker's point, to stabilizing their sort of perception of themselves and their identity, maybe taking care of some unfinished business that they had with the military or in their role in the military. I think sometimes returning to active duty gives people a chance to reflect on their civilian life in a different way. Maybe it gives them a way to relieve some pressure at home. And that can actually be, from my perspective, therapeutic, right? Work is one of the most important things that we have in our lives. And for a soldier, a Marine, an airman, that is their work, right? It is to be, as somebody told me, recently, I mean, the role for a sailor is to be at sea.
Yeah, and if I could kind of add some validity here, for me personally, I've this coming spring will be 26 years of service for me, and over the years, I've observed my peers struggling with their transitions as they exited the service, and I think what has made a difference for me is the continued focus, continued work as a service member, because I didn't understand why some of my dear friends were having such problems in their personal lives, and one of the things that I just immediately thought about was, well, they're not deploying anymore, they're not doing this work anymore, and so that is a significant identity shift that I have not had to make. So to your point there about the therapeutic nature of continuing the work. Yeah, thank you.
Yeah.
Right, and Zeno and I are currently working on a paper about the sort of liminal space that veterans occupy in terms of identity, and how it's not entirely well recognized in civilian communities, and perhaps even in military communities either, how crucial that becomes in terms of how well a person, quote unquote, reintegrates into civilian society. And it doesn't mean that every single veteran is going to struggle, because there's definitely instances in which they thrive. But I mean, given that veteran struggles are so present, that it's also important to understand those aspects as well, in addition to just there's this idea of a seamless transition from military to civilian life, which is just not the case for the most part.
So to your point, Nellie, Dr. Franco, what kinds of, I guess, best practices for this transition maybe you've observed, or maybe people have reported to you? I mean, you've got years of experience here in observing these things.
Yeah.
What kinds of practices in terms of how service member transitions have you seen worked well over the years?
Yeah, for sure. I mean, I think exactly to these points that you're bringing up, Abdullah, and Dr. Baker's pointing to in terms of veteran culture. So one of the things that I really ask every veteran that I work with, whether it's clinically or in the street, is sort of, how are you doing with displaying your status as a veteran, right? And it's a complicated question, because you'll get, you've got guys they're wearing all their hardware 30 years after service. And you've got guys that absolutely will not cop to the fact that they served in the U.S. military ever in public, and that is the range. And I say guys here, it's 80. For me, it's 85% men. So that's sort of how I'm looking at it in this part. But the same things happen for women in service and in that transition. And so I think that having that conversation, how do you wear the fact that you served in the U.S. military? And when I'm encountering, a service member who has struggled with this transition, right? And to Dr. Baker's point, it is not linear. It is not simple. It often happens over many years, like getting good with the fact that I did serve and now I'm fully retired, or I'm now a veteran, right? One of the things that I recommend to veterans that don't want it out in public, is there are quiet ways to display who you are on your truck, on your vehicle, whatever, that are only really recognizable to other veterans, right? Mm-hmm. And I mean, if you're around, which truck is a Marine truck, which truck served in Vietnam, the owner served in Vietnam, by little subtle indicators, right? And I mean, I think you all know exactly what I'm talking about, especially if you've served, some of them, I don't even know what the symbols are, right? But if you're around long enough, you can see that there's a quiet display, and just sort of encouraging veterans to think about, how am I showing up in the veteran community where other people can talk to me about this, where if somebody's struggling, they know that they can come and talk to the guy in that truck because he has served as well, right? And I think that that's a powerful way to think about peer mentorship in this space, right? Is how are you letting other veterans know, I served and I'm ready to talk if you're having a problem. And I think that that's something that military leadership could be providing a little bit deeper guidance about, both during service and also during the transition, or mustering out, however you want to think about it, right? What does it look like to have this identity piece that is something that I can display in a way that I'm comfortable with, right? Mm-hmm. And I heard a couple veterans say in some of the training that we do for medical students, really telling the students, we're not special, right? But we are different. And I think that piece is really an important thing for folks to hold and adopt, right? How is this difference important to hold on to?
And that difference is incredibly important when you are working with veteran communities. It's not something that should be negated, I think, because it can cause more pain if there is struggle going on.
Yeah, and Dr. Baker, to add on to that in terms of veterans community engagement, so how should people think about engaging with the veteran communities?
This is a really, profound question, Elena. I think what I have realized, and I've been trying to increasingly talk to military and veteran groups about, is that while oftentimes veterans feel like civilians don't care, they don't know what the experience was like. In my time in this role, I have really come to recognize that civilians are desperate to thank service members for their work, and they don't know how to do it. And I don't think we as a society, we really haven't come up with a good way, because you'll hear veterans say, "Don't thank me for my service," and I don't want a public display, and it's complicated. What I will say is this: about a block and a half from my house, there is a World War I memorial. It's one of the cornerstones of the community that I live in, and it took me a while to really understand how important that memorial is. When the 100-year mark came for that war, right? We thought about how are we going to use this war memorial to have a conversation with the veteran community, with the active duty community, with the first responder community, but also with the community as a whole, right? And so we came out to the schools and we said we'd like every school in the area to make red poppies, right? And we had 500 children in a high school next to this war memorial come and gather. We had service members in that hall, and we talked about what it was to mark 22 service members who had died. And it was a powerful gathering of the entire community. And it was a way to really recognize civilians are trying to engage. They just don't have the right avenues. And so that's an area where we have to do a lot more work, I think, in bringing civilian culture and military veteran culture together, so that people really feel that the entire community does appreciate your service. And that appreciation is part of readiness as well, right?
Yes.
That soldiers, Marines, airmen, Navy folks know that their entire community stands behind them. That is a fundamental aspect of readiness.
Right. And veterans issues don't just start when people become veterans, right? It's throughout the military life course as well that these things emerge in different ways. It's not linear, as previously mentioned.
Yeah.
Yes, Dr. Franco, thank you so much for your time. Very respectful of it. And we hope to continue the dialogue
Absolutely
in the future. So
it would be my pleasure. Yep.
Thank you.
Thank you all so much.
Important
Thank
work.
you, everyone.
Yep.
All right.
We'll talk more. Take good care.
Take care.
Bye now.
All right.